Eczema. What is eczema?
Eczema is a skin condition that refers to inflammation of the skin. It is also known as dermatitis and is characterized by itching and dry, scaly red patches. Not only does eczema cause tremendous discomfort, but it often results in unexpected flare-ups triggered by allergy reactions or environmental factors. This condition affects people of all ages, but it is most common in infants and children. In 60% to 70% of these cases, infants and children eventually outgrow eczema. Although there is no cure for eczema, a combination of conventional medications, natural therapies, and modifying your lifestyle can help. There are many different forms of eczema, and these include atopic eczema. This is the most common form of eczema, characterized by itchy, inflamed skin. This type of eczema tends to come and go. It tends to run in families, and often people with a family history of allergic conditions such as hay fever or asthma develop atopic eczema. It affects 10% of infants and 3% of adults in the United States. Irritant contact eczema. Irritant contact eczema occurs when skin comes into contact with certain substances such as cosmetics, household detergents, acids, or chemicals. It causes itchings, redness, and an irritating skin reaction in adults that often develops on the hands.
Allergic contact eczema.
Allergic contact dermatitis occurs when the skin comes into contact with an allergen such as jewelry, certain metals, or clothing fabrics. It also causes itchings, redness, and an irritating skin reaction.
Infantile seborrheic eczema.
This condition is also referred to as cradle cap and is very common in babies. Infantile seborrheic eczema is characterized by dry, flaking skin on the scalp or nappy area. It tends to spread quickly. Adult seborrheic eczema. This form of eczema appears as mild dandruff on the scalps of adults and can spread to the face, ears, neck, and chest. The skin becomes red, inflamed, and starts to flake. Adult seborrheic eczema may even be more serious than the infant version.
Varicose eczema.
Varicose eczema affects the lower legs of older adults and is usually as a result of poor circulation. Dry, itchy skin develops around the ankles or shins, and ulcers may develop if the skin is left untreated.
Discite eczema.
This form of eczema is most common in adults and is characterized by a small red patch on the lower legs or trunk. These patches can erupt or weep if left untreated.
What causes eczema?
The exact cause of eczema is not known. Researchers believe that hereditary factors as well as a malfunction within the immune system may contribute to the cause of eczema. Certain factors or triggers may also be responsible for the outbreaks of eczema, and these include irritants or substances such as soaps, cosmetics, household cleaners or detergents, chemicals, clothing, jewelry, or sweat, allergens such as dust mites, molds, plant pollens, pets, and any number of pollutants, sensitivity to certain foods, particularly dairy and wheat products, citrus fruits, eggs, nuts, chemical food additives, preservatives and colorings, changes in stress, temperature, or humidity.
How is eczema diagnosed?
The diagnosis of eczema is based on the symptoms, a thorough physical examination, and medical history. Eczema can sometimes be very difficult to diagnose and often mimics other skin conditions. Your health practitioner will ask certain questions to help confirm a diagnosis when the condition started, if the condition is irritated by contact with materials or products, changes in the environment. Certain tests such as a skin biopsy, allergy tests, or skin patch test may also be performed.
Help for people with eczema.
Treatment of eczema generally depends on the age of the individual, overall health status, type of eczema, and the severity thereof. The main aim of treatment is to reduce the symptoms of itching and inflammation and prevent the condition from worsening. Medications such as corticosteroids, antihistamines, or immunosuppressants may either be administered orally or topically. Many of these medications have potentially harmful side effects, and long-term use is usually discouraged. Another treatment option that people with eczema may also consider is ultraviolet therapy, phototherapy. For treatment to be effective, certain lifestyle changes are also very important. Eating a healthy diet and avoiding foods that may contain allergens and aggravate the skin, exercising regularly, drinking lots of water and keeping the skin well moisturized can make a significant difference to your quality of life. Although many over-the-counter and prescription topical creams are effective for eczema, using these treatments for extended periods can damage the skin. Natural and holistic treatments are a safer, gentler alternative to use without the harmful side effects or allergic reactions. Best of all, you can use them as often as you like, for as long as you like. Herbal ingredients such as vitamin E oil, Maternal piperita oil, Bulbinella frutis TR, and Aloe Frex TR work quickly to soothe and promote healthy, trouble-free skin. Other highly effective herbs include Glycyrrhiza glabra, Melia azadirachta, Sambucus nigra and Stellaria media, which help to provide relief from itching and discomfort and reduce eczema patches. In addition, Metrica chamomilla, Asparathus linearis and Galium aparine also prevents infection and inflammation as well as reduces scarring.
For more information on eczema, please visit Native Remedies and learn more about
symptoms and signs, tips to cope with eczema, related products.
Visit Native Remedies today and learn about natural and herbal remedies for the treatment of eczema. You can find the link at the bottom of this video. If you find this video article to be beneficial to you, it should be beneficial to others as well. You can make a difference by helping those who need this information. The information on this website or in emails, videos, is designed for educational purposes only. It is not intended to be a substitute for informed medical advice or care. You should not use this information to diagnose or treat any health problems or illnesses without consulting your pediatrician or family doctor. Please consult a doctor with any questions or concerns you might have regarding you or your child's condition.